is your babies, Miss Mary?
Yes, they's all my babies. Delivered about 1,400. Counting the ones come this year.
Here's my two. I'm gonna send you a real little baby picture, this next one, Miss Mary.
Well, you do that thing, honey.
Well, when I do prenatal visits, I sit right here, and I'm going to take my mask off because COVID or COVID be everything. I'm going to take it off so that I can communicate better. Hi, so I'm Dinah Warrench, and I'm a midwife. And I've been a midwife for a while, although it wasn't my first profession. I became a midwife after the birth of my first child. At the time, I was a city planner, and I thought that's who I was, because that's what I did. But my first experience was not just a very positive experience. It was one of those eye-opening experiences that makes you go, oh, I got to do this differently. And I had a midwife, and it wasn't like I had a midwife to whom I was greatly connected or anything like that. She was literally somebody I met at shift change, was a hospital midwife. I was living in Israel at the time, and she looked me in the eye, and there was something that happened that either she did or she didn't do, and then the baby came out. And I've remembered her forever. And I wouldn't say that she did anything or was anything, but it made me realize that that birth experience was special, and having a midwife was a very important part of it. And I thought, this city planning is not for me after all, and I'm going to become a midwife. And at that time, I was living, as I said, in Israel. I grew up in England, and both of those places are places where midwifery is standard of care. But when I moved to this country and discovered that midwifery was a political statement, it was just a whole other aha moment. And I started the practice after getting out of midwifery school on Lovers Lane in Dallas, which is why it's called Lovers Lane Birth Center. And at that time, there were very few birth centers locally. There are in fact not that many birth centers in the country, but Texas happens to be a well-regulated state for birth centers, and so there are more in Texas than in many states. In the Dallas area, there are quite a few, it comes and goes, but in DFW, there's probably it's in the teens, which is quite a lot considering it's a tiny slice of the birthing community. But at the time, there were only two when I started, and birthing outside the hospital had become a very boutique thing to do in a way.
I am charting. Basically kind of just going in and keeping the patient charts up to date so that we have everything here. Since there's 2 midwives here and the patients go in between both of us, we make sure that there's a story whenever we're writing, so that if I see her, that Donna is just like she was there in that visit, so that nothing is ever missed. We even have like a little checklist that we go through to make sure that all I's are dotted and T's are crossed. This is my exam room that sometimes Jeff comes in and uses to do ultrasounds. And so he's here once a week to see our moms as needed. If there's any
Hey everybody.
Times you need some sun nose, he's here for us.
Every week, we love to see your babies. We'll take good care of you.
So as you walk through, you come in, I always say that the birth center is our home away from home. So when you come in, it's not that cold, sterile hospital environment. It's your house. It's to feel that way.
If you could, can you estimate kind of the percentage of black patients or black mothers that you guys have?
Right. So before I had a black woman colleague, Crystal, working with me, it would probably be, 40%, something like that. And of course, our practice is small because it has to be, it's person intensive and that kind of thing. And so it does vary very much month to month. But I do kind of keep a little bit of a track of things. We're definitely majority minority, and at the moment, probably 55, 60% African American women, but it varies.
Yeah. Why do you think for those 55% or anybody, why do you think it's important to hire a black midwife?
Well, we all feel more comfortable with our own. That's like the story of me at El Centro, And I know I'm a Jewish woman. And it may not be obvious to the people like the color of my skin is. But when I have a Jewish client, and it doesn't mean I care for the Jewish client more or love her more. I care and love for all of the clients who are in front of me. But when I have a Jewish client in front of me, there is something about that where we both feel connected and safer in the room. And it's obvious that people feel that with each other. With a black woman, it's like 1,000,000 times more.
So the first thing is that I never dilated. I was doing everything under the sun. I wanted to have a water birth at home. I talked about having a doula. I started trying to figure out how I could make this happen in my town, because it was a smaller community where we didn't have all the resources, but I had started finding the things I needed. But once I learned about the fibroid, I realized that probably wouldn't be able to happen. So when it was close time for me to deliver, I was doing everything. I was walking. I was trying to do just sort of sit up exercises, step, stretch, and open my cervix, all different types of things I thought would work. I was even running up and down stairs, not super fast, but just going up and down the stairs to try to help me go into labor. I never dilated, never went into labor. And I had gone into the doctor for a couple of weeks, and my baby was really big. And at this point, he was laying on the fibroid. He was kicking the fibroid. So I felt very good about that, because I knew as long as he was active, he was fine. But I started to get worried because I could feel my baby scratching my cervix, and I felt like he was trying to get out. I was having sharp pains down near my cervix. And that's when I finally told the doctor, I need you to take me in for delivery, and I don't want to wait another day. I need you to take me in. I need you to take me in now. And it was probably the best decision I could have made, because I found out afterwards that my son had actually been in my stomach too long. So that meant that we could have had other problems had I not pushed the issue. When I got to the delivery room, and they got ready to start the C-section. The doctor said that he cut my stomach open just a little bit, and because they usually just need a small area to get the baby out. And he realized that when he cut my stomach over, there was a blockage at the bottom of my stomach, and he didn't really know what it was, so he cut further. And when he cut further, he realized that it was the fibroid. And the reason that my baby never dilated was because the fibroid was blocking my cervix and he couldn't get down.
Lord, that ain't nothing bothering her now. But I remember 4 years ago, she was so scared, I had to take her to the clinic myself. Back in those days, our clinic was meeting at the old building.
I don't want to voice what it feels like to be a black person, not being a black person, but I'm going to re-say some of the things that I know to be true from my perspective, all right? Which is that being a black person is a certain vulnerability in itself. And in many settings, it's more vulnerable. And healthcare is a very vulnerable setting for everybody, particularly women's healthcare, vaginas, you know. And so it's extremely important in a place of vulnerability to feel confident and safe to be open. And so obviously it's going to be easier with a black care provider. So for me, maybe I have to work a little harder. I feel like it works okay. I've been doing this a while and we connect pretty well. But I have no qualms about realizing that I'm not black. I'm never going to be black, and I'm quite happy with who I am, and you know, and the people who are going to feel more comfortable in some ways with Crystal, and that's totally good.
It's the whole granny midwives, you know. Before there was any formal education, it was kind of just passed down from generation to generation, and this was our only option, really, you know. Did I always know about it? No. One of the reasons why I really want to go to the Black History Museum that's in Washington is because they have a whole exhibit on black midwives and granny midwives, and I really want to see it.
Okay, y'all. That's how I guess people do it in real life. I mean, on TV and stuff. Take a still shot where we can do it. Send them a still shot.
All right, Crystal, you ready?
Yes, I am.
Hey, girl.
Hey.
How you? Give me a hug.
I know.
I haven't seen you in so long, actually.
It's been a while.
Yeah.
Well, it's a good time.
Woo. Yeah. All right. What you got for me? So we have some questions.
You got some? I got some for you too.
All right. So my first question is, tell me about your first birthing experience and how it led you to the current work you do.
My first birthing experience that led me here, I really don't think it was a birth experience, if I could be honest. It was a prenatal visit. It was an older black lady, and I say older because she's older for what they would consider to be having babies still. She was like 41, 42 on baby number 8 or 9. You know, people don't do that so much anymore.
Yeah.
But she was having her first out-of-hospital birth, and her and Donna were just conducting the visit. I'm a midwifery student at this time, so I'm just kind of sitting back being a fly on the wall. And she interrupts Donna. I'm sorry. I looked for you.
Wow. And she's talking about you.
I looked for you.
Mm-hmm.
Finished school. And I'm like, okay, I finished school. She said that she did Google searches and she was looking for black midwives, and she looked in the whole DFW and I could not find anybody. Finished school. We need you. Yes, ma'am. I finished school. I actually ended up catching her baby, and I say catching her baby because she walked in, and you know, the more babies you have, the quicker they come. But I literally caught that one, and I was glad to actually be able to be that person because I know how she felt about it, and it's just funny how things work, though. But yeah, it was her that did it for me. I mean, I still have chills just giving the story.
It's powerful. Wow.
What would you say yours was?
I think it had to be my first personal birth experience.
Really?
Yeah. So I had, I was 20 years old, having my first baby, and I wasn't prepared. I didn't know, you know, what I needed to do to prepare my mind, body, and spirit for birth, and it showed. So my doctor wanted to induce me, and I thought it was like a good idea. I'm like, okay, you know, I'm tired of being pregnant. Sounds good. And what happened was it turned into an emergency C-section. Yeah. So the emergency C-section was really traumatic for me because I just wasn't prepared for that. And I just said, okay, well, if this is the way women are experiencing birth, then I don't want to do it again. I don't want to be a part of that. So then when I got pregnant again a few years later, I knew I wanted to do something different. And then I ended up having an out-of-hospital birth, a water birth, and it just changed my life. And so from there, I knew I had to share that with other women like me, women who were young and 20 years old, didn't know. And I knew I learned something, I felt empowered, and now I needed to pay it forward to other women.
Good.
Yep.
So, I guess we should have started with this one, but how do we know each other, Miss Ebony? How did we meet?
Well, we both birth workers, but in a little bit of a different capacity, I would say, for sure.
So, we met, I remember when I first went or came back to Lover's Lane, right? It was all on Facebook and all of these things, and you know, I'm not real big on social media, and there's this so-called buzz, and you know, I still get on this like, why do people even care thing? But I remember it just keep seeing you posting, and you're saying you had so many positive words to say about me, even though you never met me. So we just met, right?
Oh yeah, and you know what? I always try to like highlight different midwives and black midwives because, like you said, it's not a lot. And so even though I didn't know you personally, I knew that just like that lady was looking for you, we were looking for you like as doula. So I'm a doula, you know, you're a midwife, but we didn't have a lot of black midwives to refer to, and I was excited and I wanted to share with everybody. So you were a part of moving forward with our mission. And then I reached out to you because I was like, you know what? I want to meet her.
Yeah, let's meet.
And we met, and we just been cool ever since.
And Ebony was my doula. You know, it's unusual, or not necessarily, but for a midwife to have a doula or to go through childbirth education, but it's not just my birth experience. You know, you were there to help make it a whole experience for both me and my husband.
Yeah.
And I'm thankful for that.
There too when you feel one coming, honey. But pretty soon I want you to start pushing down and pant like a dog. Remember now, that's to keep the baby's head from coming down too fast. What you want this time out of, a little girl or a boy?
It don't make no difference to me.
I have this. What is the history behind black women serving as midwives and doulas throughout history? And did you always know of this history?
So the history is back, y'all. The history is back a whole lot further than any of us really know, like back to the 1600s and how it was the granny midwives doing it all, how it was, and it was called granny midwives because it's your grandma that taught her daughter or her granddaughter or her sister, and it's kind of like this practice that was passed down from generation to generation because there was no, real formal training, or we couldn't, as Black folks, we couldn't get the same type of health care that other people did. So we had the granny midwives in the neighborhood that would catch all the babies and provide the care and all of that for them, and it kind of became a taboo thing, as time progressed in the 1800s. Then it was more women doing it, then it became a male, white-dominated thing, and of course, don't go to them because that's not okay. And it was slander, like you used earlier. Did I know about this? I did not. I didn't know anything, if I could be honest, about midwives growing up, especially nothing about out-of-hospital births. It always was like, one of the hippie things. You go in the woods, you pick a tree, this is a good tree, and you squat here and have a baby, That was kind of like the taboo behind it. And the more you know, right? You know better, you do better. And I'm just grateful to have known the history and to be where I am now from it.
Yeah, I think one of the things that stood out to me learning the history of Black midwives was that not only did they catch the community babies, but a lot of them caught the white babies.
Because they had more experience, or they taught the people.
They caught, white babies as well. And for them to go ahead and do these slander campaigns and just totally wipe out a whole sector of people was amazing. It's crazy. It set us back. And so, no, I didn't know about, our history either, because it was kind of successful in what they did.
Right.
And so we weren't taught all of these things. Some of us may have kind of heard our grandmother or auntie or great-great-grandmother was a midwife, but we really didn't have a concept of what that meant.
Right.
And so it's just amazing to be able to be doing this work and really bringing back who we already were, bringing that education and awareness back, and being like the trailblazers in this work.
I mean, it's still like some of the slander still has stayed. It's still present today because, oh no, don't go there. You have to go to an obstetrician. You got to go to the doctor when you're in labor. Who is this person? Who is this midwife? Does she have the education, the know-how, the skills? I think the good thing with the pandemic is that it's shown light on us that we aren't just normal people, that we have formal training, that we have the background, that we have the skills, and that it is still safe to be with us.
Yeah, definitely.
Little Miss Dixon always try to help mamas feel easy the first time in the clinic. Of course, I've foretold out already what they're going to do. How they take each mother's temperature and feel the pulse. Every time a mother comes to the clinic, they measure her blood pressure. That's another way they can tell if she's keeping in good shape. Or if she ain't, things she had better do to get herself well so she can have her baby more easy and normal.
All right, how we doing? Good morning. Look at our big boy. Don't tell me he got on a little jacket. So we are going to be kind of just catching up, seeing how you're doing, how he's doing. Since we haven't been to the pediatrician yet, we'll do newborn screen, weight, all of those things today, okay? You can sit on down. You look good. How you feel? I love this question. This is the best one I think we got. What is the difference between you and I? What's the difference between a midwife and a doula? And what are our roles?
Well, you know what? I think it's a big difference between a midwife and a doula, and people don't realize that. And we get asked this question all the time because it seems so familiar because we're in the same space. So a midwife is that actual care provider, that medical professional who's been trained for years and have to really go through a lot of rigorous training. Not only just training, but you guys have to take state exams, get licensures, and you do vaginal exams, you do blood work, you do labs, you know, take that place of the obstetrician. A doula, though, is more of that support person, you know? We're there to kind of be that emotional support, that guidance.
That advocate.
Advocate, yeah, you know, that moms need. So that's the difference.
Yes, and some people say, well, if I have a doula, then, if I have a midwife, why do I need a doula? Or if I have a doula, why do I need a midwife? It's two different spaces. Like, we are a team. We work well together. Just like if you have an obstetrician, you still need a nurse. You know, you can't really have one without the other. So I feel like we work very well together to make, just make it come full circle.
Yes, it's not one of those things to where it's either or. People often ask me, should I get a midwife or should I get a doula? Yeah. You should have both, because it's going to help for a more well-rounded, organic, and holistic experience.
Good. I agree.
Yep.
So this is the backup room. If there is ever a time where you need to do any observation, let's say that you come in and you're telling me your baby's not moving. We have a fetal monitor here so we can do non-stress tests if needed. If you're dehydrated, you've been having a lot of vomiting, and you need an IV or something like that, we'll also do that here. And just in case our babies are having a birthday party and we're tag teaming, we also use this room as a backup. It Jack and Jill's to the bathroom in there, so you're still able to have your water birth even if we are attending to another mom.
So Crystal, while she was in school at Texas Tech, came here to this practice to do her clinical practice, or at least part of it. And by the way, small plug, because this is a Texas show. I love the Texas Tech program, and shout out to Becky Burpo, who started the Texas, well, did she start it? I'm not sure. Yes, she did start it. Anyway, the Texas program is great, Texas Tech. And she was a good student. I don't think she thought birth center particularly was for her. But, that's for her to say. She just came here because she came here. But we got on well, and the clients enjoyed her. And she wasn't my first black student, but having quite a large black clientele, it obviously was helpful to have a black student. And I wanted her to come here after she finished, because I actually had a position, I think, at that time. But Crystal had a young child, and she wanted shift work and better hours. And so she went to Parkland Clinic. And Parkland Clinic is a good place to learn a lot. But you do burn out just a little bit. And I would call her every so often and say, are you ready to come? You want to come? And then I began to feel I was getting older, and I'm looking around for who's going to take over this place. And I'm like, oh gosh, I need someone. And if it were a black midwife, wouldn't that be better? And I actually experimented with, I was always working with different midwives, and I had a midwife working for me who was a black midwife. She was a direct entry midwife, but that didn't work out well at all. So there was definitely something about Crystal. And we're not very alike at all. She's tall and I'm short. Just going there. But we did work well together, and we actually have different practice styles too. I think she's much more matter of fact. I'm a little bit more all over the place, and that's always good. That's good too. And I was desperate, and I called her one more time, and she said yes. And that was great. And so we worked together, and I can't remember at what point, or I think I'd already talked to her about buying the place, because I was a little bit, you know, I want it to be not just black staff, but black owned. And I also thought, you know, I don't want to leave this. This is the kind of profession that you want, you know, it's your identity forever. But, you know, it does get old to get up at 3 a.m. consistently, again and again. And so I had to get a good way forward. And I think Crystal is a good way forward for us. And so she now owns, and I work for her, and I enjoy that so much too. And the changes she's made, I so appreciate, and the investment that she's made, I so appreciate. And I'm just excited that it's gonna still exist and be the same but hers.
It's the little crab on the booty head right here. Oh, I think he's gained a bit. How much was he at birth? He was
7 and 10.
7, 10. Hey, his color looks good too.
In considering community resources and environment, such as environmental pollution, the availability of access to fresh quality and healthy food, access to affordable health care and preventable medicine and reproductive education, how would you characterize these elements in the communities in which you are based and their effect on the women you serve?
I think, oh, sorry.
So I was just going to recap the environmental pollution, the availability and the access to food and medical care and all of those things. How would you characterize these elements and their effect on the women we serve?
So I think one of the big ones, I don't know if you mentioned this one, was education in it as well, because as I mentioned before, when you know better, you do better. Some people kind of go with the mundane because this is all they know. Mm-hmm. And then with resources, when it goes back to this is all you know, like when you grow up in a neighborhood that doesn't have a Whole Foods, or right. There's no Chipotle's, there's only McDonald's and Burger King. When you have these things around you, that's all you know. It's easy, it's accessible, it's cheap. You got noodles, you have these things that's easy to eat, but none of these things are healthy, right? You know, for you or for your pregnancy. Yeah. And access to having those things, but then also the know-how to know that you need to really seek out for these things. And the inaccessibility of it, I think, is what's leading to some poor outcomes. Even when it comes to maternal health, because number one, you don't know that you need to advocate for yourself, just right. as you did as a 20-year-old, you didn't know. Number two, you are putting this junk, literally junk, into your body. And how do you expect for you not to have excessive weight gain, for you not to have gestational diabetes? Nobody think about the big thing of protein and skin integrity. How are you not going to have these terrible tears and right. Things like that whenever you give birth? You know, because you didn't prepare properly. You didn't exercise, you didn't have the same walking trails that everybody else did, so you don't have the energy or the stamina for birth. The accessibility, the education, just the food and resources, I think, directly impacts just the care that they get.
Yeah, I agree. Especially like we're here right now in South Dallas, and we're in a community where the disparities are great, you know, with maternal mortality, their access to care, the equity, everything is just we're lagging behind in all those markers greatly, even more so in some of these areas than 3 to 4 times as Black women dying. And so I think that affects everything. Like what you said, if you don't have that access, you're not going to be able to get educated. You don't have the access to certain foods and different things. And being pregnant and giving birth is all about growing something in a healthy way, preparing your body, and being able to mentally push out this life, right? And if you're under stress because of your environmental factors, that plays a huge role. So what's the effects? So the effects is like you said, so
Poor
the
outcomes.
diabetes, poor outcomes all across the markers, you know, from different conditions to unnecessary cesareans to postpartum
low fetal
depression.
Weight. It becomes it's like the domino effect. You know, and then but it's also generational, right?
Yeah.
Because my mama delivered here, and I'm staying at home with her. She's the one who's feeding me. Well, I did this when I was pregnant, and we didn't do those things and all of that. So you just don't know. You know, you pass down what you've done because you did it and you turned out okay. For the most part, you know.
Yeah, and so that's why I think it's important what we're doing, because, you know, we are, you know, giving people that education and bringing that awareness to the community. And if you don't know, how can you do better? And so, you know, being a part of changing things and educating people, I think the next generation is going to be a lot better for it.
Little Miss Dixon always try to help mamas feel easy the first time in the clinic. Of course, I foretold out already what they're going to do. How to take each mother's temperature and feel the pulse.
And so I go to this community college, and I didn't know anything about race. I just wasn't, it was not on my horizon. And I did not, as I said, I did not really identify with the Texas community at all. It was not my culture, I had discovered. And I found the white women in the program were very, very different from me in a way that I found a bit uncomfortable. But the Black women in the program thought I was obviously also a little weird, because I wasn't like them either. So it was a bit of a lesson. And it was a lesson about racial identity and how I was white whether I like it or not, you know. And so that was sort of where I learned about it. And I was very clear in my head that I didn't particularly identify with that white community, but I didn't have a choice. That was who I was. And so I think it made it so that when my practice began growing a little bit, it was a little bit more diverse, not just because I took Medicaid, but also because some of the other practices were a little bit less diverse. And I was, so it all kind of just was all part of my education as a midwife, that it turned into that. And it also wasn't like that right away. You know, I just took any comers, and I still do, of course. And it just developed in its own way, and it certainly made a difference that I took Medicaid. Well, it's important, firstly. Midwifery is, to me, it's so important and so tragic that it's so sidelined and so non-mainstream and so totally unacceptable. Every woman, to me, deserves a midwife. It's not something that's just for a few kooky hippies. It's not something that you have to be able to pay for. It's one of the oldest professions ever. It's the quintessential women's profession. It's how women's bodies are supported and loved. And you've got to be able to afford it. And in this country, that means it has to be a network. And in this country, that means, for Medicaid, a huge proportion of women who are pregnant in Texas, it's more than half, are on Medicaid because it is a little easier to get when you're pregnant. And if a practice closes that off, they're a niche boutique practice. And that's not what midwifery should be.
Hold still now, you little scrummy wummy. You'll soon be through.
Tell me, Mama, who do it favor?
It's too early to tell yet a while, honey.
So many states currently do not require doula services to be covered through insurance. Why do you think it's important for insurance companies to cover doulas?
Access, like we were talking about, how can we really have equitable situations and fair environments where all people thrive, when
not just the haves.
Right, when only some people can have access to what we know statistically is better and gives better outcomes to Black women.
Right.
So
that's why I accept insurance. I'm one of the few birth centers that accept insurance, and I most definitely accept Medicaid as well because I want to still reach that population. But the main reason why I do is because you're paying into this premium every month, right? So you're expecting to get something out of it. And I think that the reason why a lot of people don't seek out for us is because they don't know that it's an option with their insurance. And when it becomes an option is when you start to dig and go deeper. I think that access to care should not be limited to just those who can afford it.
Yeah. And your birth center is one of the only ones in the DFW area that accepts insurance in that way and Medicaid. So even with that, it's still, we need more. We need more like you. And we need, rules and legislation passed to where these insurance companies are also paying you guys, the care providers, what you're worth, so that, there is more of an incentive for care providers to be able to take care of the community and also have sustainable livings for themselves and their families. So I definitely believe access should be, but at the same time, make sure that the people who are doing the work are able to have sustainable livings.
Agree.
Okay, so why is it important to consider using a Black midwife and doulas, and how can we help to train more to enter into the profession?
It is important because Black people still get pregnant, y'all. That ain't surprising, right? But the reason why I'm saying it that way is that it has been proven that you have better outcomes when you deliver with someone of your same race. So that could be one reason why we are falling behind, because sad to say that there are more white obstetricians and midwives, so they're able to easily find someone of their same race when we literally have to seek out and search in order to find them. So that's one reason why I feel like it's important. My role in trying to develop more midwives is I precept or orient or train midwifery students. When I was out here looking for a clinical site as a midwifery student, it was tough. I would get people that would agree, but then they'll never call me when there was a birth, or the patients would decline me to be there, or they'll just tell me that, okay, no, they said you didn't want to be there, so that's why I didn't call you. Especially as a student midwife of color,
Mm-hmm.
it is very tough because they want to make sure that you go along with their dynamic or whatever that they have for their establishment, which is fair and understandable, but we should still be able to have the access to training, the access to education, because right now there's so many student midwives, but it's hard to go beyond that because the preceptor sites aren't there.
Right.
So it's real big for me to be able to stay a preceptor site and to try to bring on those students that are not accepted in other places, especially student midwives of color.
Mm-hmm. Yeah. I was thinking as you were saying that, number one, you are the first Black-owned birth center in DFW.
I am. And the second in Texas.
The second in Texas. We have somebody in San Antonio.
Mm-hmm.
Yes. And then in the country, it's only how many Black-owned birth centers? A few?
I'm 11.
Number 11.
Out of 345.
Out of 345 birth centers. It's only 11 Black birth centers.
And
And you're number 11. Okay. So that's the problem. I mean, that's the problem.
Essentially.
You know, and so when you say that, I know for doula work, it's important as well because, again, you know, back in the day in the 1600s, 1700s, we were the ones who were working together as midwife and doula, helping these moms to bring life into the world, you know. And now essentially we're trying to get back there, and it's like the doors kind of been shut.
Right.
And so we're trying to, what we've done, people like you, people like me, have kicked the door down and have taken a lot of sacrifice. And, you know, the road has not been tough with you. You know, as a doula, it's a little bit easier to get training, you know, but as a midwife, I know I sit and hear your stories, and it's incredible the type of disrespect, the type of different things you have to go through in order to find someone that can really train you. So I think right now, just you guys have, especially in Texas, kicked the door down a bit. And now we actually have we have a handful of Black midwives who are licensed professional midwives. I'm so excited about that.
Yes.
And any chance I can get out, you know, like with you, it's like I'm gonna let other people know that they're out here, because just a few years ago we didn't have anybody. We had like maybe two. We just had two. We had like 2 out of hospital midwives only. Now we have
you gotta see and count them. Yeah. When I came to Lover's Lane in 2019, I was the only Black certified nurse midwife. So there is certified nurse midwives and certified practitioner midwives or professional midwives. And the difference is that I was a nurse first, but we're still midwives. But at that time, I was the only Black CNM practicing out of hospital. But to see the numbers now
changing,
it's a happy place for me, because I actually trained a few of them that's out there, and it's only been since 2019. So
it's only been a few years, and now we're out here. I know when I started as a doula, it was maybe 10 Black doulas that were really out here working. Now we have dozens and dozens of Black doulas in the DFW area, and I try to help be a part of that by training up and coming doulas.
With your agency, you're doing that as well?
Yep. So I have the first Black-owned doula agency in Dallas, and so we do, you know, try to train the upcoming doulas and put quality people out there. So we're working to make sure that we do our part.
I always visit my mama's ahead of time if I possibly can get to it. Of course, I know before I got here, and Matt and I would have everything fixed up nice.
So he ended up cutting me from hip to hip. And when they cut me from hip to hip, they were able to deliver my baby. And then my baby had to leave the delivery room because they said I had to have surgery. He performed surgery on me. It took about 45 minutes, and they finally cut the fibroid out. And I was wielding to delivery. I was very groggy, but they brought my baby in. I had previously expressed to my mom that I did not want them to put me on a lot of medicine, just because I still wanted to be as close to the natural experience as possible. So I was like, I don't want any more pain medicine. I don't want any more pain medicine. And And they were saying, you know, are you sure you feel okay? And I said, yes. And so for a while, they listened to me. The thing that ended up changing it was my mother told the nurse, ma'am, please do not listen to my daughter. She has had surgery, and she is going to be in a lot of pain if she doesn't have some medicine. And the nurse said, she what? And my mom said, she had surgery. And the nurse said, she had surgery? And my mom said, yes, they took out a fibroid, a pretty big one. And the nurse went and checked the charts, and she didn't see anything about my fibroid. And she left the room, and she came back, and she asked me to please let her give me some pain medicine, because if not, I was gonna be in some really serious pain that night. And when I realized that they didn't know what happened, I think that scared me more than anything, because I felt like if they don't know I had surgery, then I don't know what really happened during the procedure. And it has forever impacted my future, because I still question if when I get ready to have another child, will I be able to reproduce? You know, you have your traditional pap smears and everything that you go in to get a check for regularly, but I still don't feel 100% sure that we know the answer on that until I get ready to actually plan to have another child. If I can explain it this way, I don't believe that my doctor was a racist, but I do believe that the way that doctors handle us is often assumptive based on our race. And I do believe that that played a role, because I don't feel that I was given enough information. Even when I found out about the fibroid, I don't feel that I was given enough guidance to understand what options were available and what I needed to do to protect my son.
So, when I talk about vulnerabilities, I did emphasize it specifically for Black women, but I think all women are very, very vulnerable when they're pregnant and laboring, in labor most of all. And it's so simple what they want to need. They want to feel listened to and a sense of control, like we all want in life for everything, you know? And although there are lots of objective, kind of more measurable physical things that occur to women with Black bodies, the truth is that a lot of it's got to do with lack of respect and lack of listening and the inherent vulnerability that they're in. All right, so I have a friend who is a Black midwife, not Crystal, a different Black midwife. She's actually British Nigerian, but she's a midwife. And she knows a lot about giving birth. She was a midwife 10 years before she moved to the United States, and she's midwife here. And yet when she was in labor, and she knew what was going on with her body, not just because she knew because it was her body, but because she was a midwife, nobody listened to her. She was bleeding out. And they were slow, and in the end, she had to shout at the staff and say, "Get the OR ready, I need a C-section now." I mean, it's soul-destroying to hear those stories. And of course, then you get to Serena Williams, but it's really just about listening. That's all it is. And respecting, because not listening is just not respecting.
You people seem to be new around here to me.
Yes.
Well, how far are you along with this pregnancy, honey?
About 6 or 7 months, I think.
What did the doctor say about your case, honey?
She ain't seen no doctor.
Oh, well, before I can take her case, she'll have to see a doctor.
But it says statistics show Black women in the U.S. are on average 3 times more likely to die due to pregnancy complications than their white counterparts. Why do you think this is?
Because of the implicit and explicit racism and biases that we just kind of talk about.
Yes.
So they've done studies, and the studies have shown that although there are all of these kind of branches to the root of the problem that Black women die from, like high blood pressure and, you know, different things like that, all these other factors, when they really got down to the root of the matter, they found out it was simply systemic racism. Basically. And so that's it.
I mean, honestly, I was a part of the problem. I started as a labor and delivery nurse, and I have done travel nursing, and I've worked in all of these different hospitals across the U.S., both private and public, and it's really just the way that we are taught, the way that we're taught to do things, the way that we're taught to handle women and patients, and it's the way that it's done and kind of put there, you don't even realize that you're doing it. Even as a patient myself, when I was giving birth with my son, I delivered on the unit that I worked on as a labor and delivery nurse, and that I was also a midwifery student on. I knew all of the nurses, I knew all of the obstetricians, but when there was a complication to come up and I had a fever and nobody can figure out the source of my fever, I'm laying there and they're telling me it's one diagnosis. If I was the normal mom, I would have just accepted that. But I'm telling them, y'all, that is not it. That's not it. I'm telling you that's not it. I understand what you're saying, but I'm telling you that's not it. I know what that is supposed to be.
Right.
And I had to continue. Every doctor and nurse that came out, that is not it. And I had to fight for myself on the same unit where I knew these people.
Wow.
And the second day when they did blood cultures, they found out that I was septic. They were treating me for a uterine infection when essentially I had a UTI that got so out of hand that now it's in my bloodstream. When it gets to your bloodstream, it can travel to other organs and cause, you know, catastrophes. And it's just like, what if I didn't say, look further, look further? I could have been this number.
Yeah, and you're a whole midwife, you worked there, a midwife student, you worked there, you knew these people personally.
And I still had to fight.
You still had to fight. And so that speaks to the statistics that shows that they've done studies and they found out that no matter the social economic background, no matter any of your financial statuses or who you are or what bracket of society you're in, that Black women are dying more, period. You know, and then you get these celebrities who have kind of spoken out and talked and shared their stories, like Serena Williams, how she almost died after delivering her baby. Beyonce had issues. Yes, Tatiana Ali.
It's not just class.
Right.
It's not just education. But anyway.
Did you guys just find out?
Yes.
Yeah, just right now.
Just found out that I'm having a son. She's having a son. I don't even know what to think. I just know that I feel great right now.
That's awesome.
Yes.
Congratulations, you guys.
It's bad, but we expect certain people to have certain complaints, okay? And because I'm expecting this from you, when you tell me this, I kind of sweep it under the rug and I don't treat it the same. And then also there's this strong Black woman stigma that comes as well. You know, I go home and I'm sitting here and I'm telling you all of these issues I got going on. Girl, I've been having this headache. It's getting on my nerves. I'm taking this Tylenol. I'm doing all of that. But when I come to my prenatal visit, I don't necessarily feel comfortable with you, so I don't share that with you. But I also have downplayed it because this is nothing, you know. You're going to have headaches during pregnancy. You know, so don't go in there complaining, you know.
Right.
We even have the phrase, I won't complain. You know, I'm okay, I won't complain. And so one thing that Donna used to say is she says, well, complain, tell me. If you can complain, then tell me. So I think part of it is us downplaying and not sharing our illnesses. And I also think the next one is categorization. Them just kind of putting us into this bubble, and well, they tend to have high blood pressure anyways, or they tend to gain more weight anyways. Like, she complains, she's a complainer, you know, that's just kind of what she does. Putting us in these bubbles, in these situations, and it's kind of, it's how we're losing people.
Yeah, I feel like, just to piggyback off of what you're saying, that even like the history of it, so you have, you know, obstetricians who used to go ahead and use black slaves as test dummies.
They actually said we didn't feel pain.
Yeah.
So when they did these, they kind of like explored
experiments.
The female anatomy, and they did it on black women without any anesthesia, because black women don't feel pain.
Yeah. So we have Dr. Sims, who was the one who they call the father of modern medicine, gynecology, but his test subjects were black slave women who were oftentimes not given in anesthesia or anything, as he's trying to figure out the anatomy of women and using these women as his test dummy. So essentially, on the backs of black women was all of these discoveries made, but yet and still a white man gets to be named and given that credit. So in many, many circles in medicine right now, they have campaigns where they're like, don't even mention his name.
Yeah,
and
I mean, it's for him to be the father of it, it's a whole mess.
Dr. Newton said Maybelle ain't been eating right, and it shows up on her. He says every mother ought to have a good examination all over as soon as she thinks she's pregnant. He said Maybelle ought to start getting her checkup months ago.
Because I always tell my doula clients, like, ask questions. It starts with asking questions.
Yes.
And don't be okay if you feel like don't feel like you're bothering your provider. And if you do get like a little feedback or a little pushback and it makes you feel uncomfortable, then maybe we should explore if this is the right provider for you. If they're not willing to hear you, see you, and kind of like educate you. Because sometimes, as you said, care providers, if it's a doctor or whatever, most of the time they don't have a lot of time. So you kind of making them stop for a minute and hear you and say, okay, well, I don't understand that. Can you explain that to me? And after a while, if they're not able and willing, then maybe it's time for you to look into another provider. So always ask questions and be willing to educate yourself, and just really not just take what everybody say, but ask questions. One thing I love to use with people that's really, really simple and helps them remember is I always tell them the BRAIN method of asking your provider questions. So it's basically, an acronym. So each letter stands for something. So you have B is, what's the benefit? So if your provider is saying, hey, let's induce you at 37 weeks, and moms, they don't know all the nuances of everything that's going on, I said, just remember BRAIN. And if you're uncomfortable, go through that whole script. So say, okay, well, what's the benefit of me getting induced? Okay, R, what's the risk of me getting induced? Okay, well, what's the alternative to me getting induced? And then N, what if we do nothing? So I say, like, run through that if you have something that really just makes you feel uncomfortable, and kind of have them stop down and explain to you. And then oftentimes that helps them to decide if they want to even move forward with the provider, because some providers are like,
don't have the time to try to answer.
What?
Yes.
It's fine.
They don't want to be questioned.
They don't want to be questioned.
So what are some of the misinformation that individuals have about using a birthing center?
I think the biggest misinformation about birth centers, or just out of hospital birth in general, is that it's unsafe. They feel that when you birth with us, that if an emergency was to arise, number one, that we don't know how to identify it, or that we don't know how to troubleshoot. I think that's the biggest thing. So one thing that I try to inform them of is that, I have my master's in this. And before you can even go back to school to get your master's, you have to have a certain amount of years in labor and delivery and experience in this area to even say that you're a candidate to be accepted into school. So I've worked, I think that's the biggest misconception. But we also have supervising physicians, we have consulting physicians, we have relationships with hospitals. There are things there and resources there, especially if you get the right provider. I think that's, and plus, that it's the hippie thing to do. It's so taboo. So I have to remind
black women don't do it.
Exactly, or that, girl, you gonna take that pain. Those things, they feel like they can't do it. So I try to educate them about the risk associated with it, and sometimes when you do nothing, you'll be surprised what happens. And also when it comes to like them mentally preparing, there's a quote from hypnobirthing, and it says that when you change the way you view birth, the way you birth changes.
Yeah. I said, we're not the help, we're the rescue. Let me make this plain and simple. We the ones he sent to you. We're Moses freeing Israel. This ain't ego or mystical. I'm like, let my people go. This is biblical. So who's rolling with us? Who's against us? Because we be in the trenches. Black doulas and midwives, just to mention. You gotta be relentless. In pain, but they don't listen. But they gonna listen. Saving Black mamas' lives is our mission.
I like that.
Yeah, I like
that. That's our mission. I like that.
That's our mission.